What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering the challenges of doing x-rays with patients on wheelchairs. So to give you context, I'm a night shift x-ray tech, work 7 on, 7 off. A lot of day shift because I work overtime. So wheelchairs. So usually it's not a problem for certain exams, shoulders, chest, C-spines. It can be done, but it's kind of hard because of the IV pole. But I'll give you each niche little situation, okay? So we'll start with the bread and butter chest. Chest x-rays, mainly for one views. We're talking about for portable type of situation. You have to place the board, and depending on the patient, some patients, like, you can't shove the board down enough because the little armrest will get in the way. So sometimes you'll have to angle down to get the bottom and then pull the board up, and you have to angle up. So you may have to do two views. Other times patients can't raise their head all the way because they're old or they have scoliosis or kyphosis or whatever situation. So once again, it's probably going to be a two image, one to get the chin out the way and then another one for bottom. Sometimes they're like really skinny and they can't hold the board, so you're going to have to like play Jenga in the back, trying to balance it to get stuff like that. This is mainly for portable. Shoulder, same thing. You can do shoulders. Typically, like the internal, external shoulders aren't a problem. It's kind of when the Y, where the patient will rotate and the board has to be balanced in a certain way, and you hope to God it don't fall. So, like, that's kind of a situation where it becomes hard. Same thing with the humeruses. And then, I mean, for wheelchairs, once again, if you're doing two views, you'll have to shoot one portable for the AP, and then lateral will have to be cross table type deal with the wheelchair. Have patient like lean forward and stuff like that. Me, who works night shift, does a lot of things on wheelchairs, or like I'd rather do them to not have them to drag them all the way back to the room. Same thing, but like if they're just chilling in a wheelchair and you have to do a foot or a femur or anything, you just kind of prop another chair or wheelchair, whatever, next to them, and then you can just kind of do it like that. Other times you can just bring in like a tech and hold the board, and you can kind of use like that. There's different ways. I know what you're saying. You're like, Miguel, but dose, radiation, and all that other stuff. Sometimes certain patients, it is ideal to do them on the table for certain exams, but other times the patient itself, because either the way it's broken or their pain levels, or because it's America and they beggins, it's easier to just do it on the wheelchair. So all that comes with time and come with niche situations that you'll just have to deal with. Sometimes you don't have the manpower to move Bubba, who's 500 pounds, off his little wheelchair onto the table. Like sometimes, it's just not ideal. Cross tables and all the stuff like that you'll have to take care of. That's mainly all the big ones we do most of the time in the emergency room when we do in wheelchairs. More older patients and people who can't breathe or are dizzy, and it's mainly just chest x-rays. Majority of the time it's just chest x-rays, and sometimes if they can't walk, their feet and tip fibs we'll have to kind of do. You don't have to do it that way, but at nighttime we kind of do it like that just to make it more efficient and easy. Yeah, it's pretty where we go. See you on the next one.